Hi, my name is Mary. Healthcare is my job. I work globally on access to medicines, particularly for HIV and tuberculosis, for infectious disease in Africa. And I've spent my life living and participating in communities where there is no safety net, where a life ending healthcare disaster is life ending. Whereas in the United States, most times when you encounter a potential healthcare disaster that could be life ending, it doesn't end up being that way because we have a safety net. So I've seen firsthand how bad it can be. You have an injury, if you have a pre existing condition, if you can't access regular medical treatment, or if drug prices are too high, the impact it has on communities and families that don't deserve it. As a result, I'm very concerned about the state of healthcare in America because I really believe that we have an opportunity to preserve the health of all, despite political need and despite distribution of wealth and the ambitions of those who are wealthier. Most of the other countries I've worked in have a really low GDP and sort of low economic productivity. There's a lot of people who are out of work, and there's no employer-based health insurance. Most of the health insurance systems are ad hoc and mostly private. So that means that there's not very good money. There's not a lot of money in the medical system. And so if you go to the emergency department in a lot of major cities in poor countries, you'll see that there's not a lot of commodities, not a lot of supplies, not a lot of diagnostic tools, and not a lot of medicines. And there's a lot of improvising without those things. A lot of American doctors who go to work in these institutions are shocked when they first arrive by how little infrastructure is there and how little they have to work with in order to save lives. So that's sort of the first way that you see it. The other way that you see it, I think, predominantly is that it manifests in really long wait times and low distribution of resources. So people will travel great distances to come to a health facility, and then they'll end up waiting for a really long time for care that meets this minimum standard, or in some cases doesn't meet the minimum standard. And so that's what we could be facing here. We could be facing more crowded emergency rooms because fewer people have health insurance, and so they're coming only when they're in a crisis situation and they have to go to an emergency room because it's their only option. We could see reduced funding in the medical system, which could manifest in worse tests or fewer tests, worse drugs or fewer drugs, more expensive drugs because of kickbacks, those kinds of things. And they have a personal toll. I mean, they affect people's day-to-day lives. I think that's what we're up against here and what we stand to prevent with the right legislation. My mom has a pre-existing condition. She has two, actually. And so she is not on Medicaid, but she's part of an elderly program in North Carolina that gives her subsidies through the Obamacare exchanges. And so she's able to get better care through Obamacare for the next year until she qualifies for Medicare, which is obviously superior care at a reduced cost for anyone over 65. But in the next year, she stands to lose that benefit if she's not covered under the new bill. And according to the provisions that were set up in the Senate and reviewed by the CBO on Monday, it looks like she would actually probably lose her current very good care for her pre-existing condition and for her ongoing medical treatment unless they kill the bill. I would like to see American Democratic senators stand up for what they believe in on a value-based level, not just for what they believe in terms of their own reelection or in terms of the money in politics.